And with me to answer your questions, Kavita Vedhara, Professor of Health Psychology at the University of Nottingham, and also I'm joined by Dr. Bharat Pankanya, a Senior Clinical Lecturer at the University of Exeter Medical School. Thank you both for joining us. Lots of questions, so I'm going to go straight on. Professor, this one for you, I think. This is from Alison. I received a letter from the government during the first wave stating that I was extremely vulnerable, so advised me to shield. In August, shielding was paused. So what will happen now the virus is rising again? I feel very anxious. There's been no communication from the government offering advice or reassurance.
So this is such an important issue. We and others have found that, not too surprisingly, it's people in this shielding category that experience the greatest anxiety and depression. So I think this is an area where the government needs to very rapidly produce very specific guidance on the ways that people can protect themselves. OK, now, Doctor, Tom in Stockton-on-Tees asks, what effect will pubs and restaurants closing at 10 o'clock in the evening have when they will have been open the rest of the day with people coming in and out?
I personally think this is very symbolic. What we should do for whatever these places are, pubs, clubs, restaurants and similar, where people are gathering, is to look at the transmission points of infection between people, between humans. So if we were to address it thoroughly and again thoroughly and then once more, we might actually be able to continue to trade and trade safely. So really what we want to do is put in measures for preventing transmission of infections rather than a symbolic measure which says, I'm going to shut early. Professor,
do you see it as that?
I think it's perhaps very disappointing for a lot of people today to hear that the major initiative seems to be closing the pubs a little bit earlier. I think it would be very helpful if what had been communicated is the evidence underlying that. As far as I can see, what's probably likely to happen is by closing a bit earlier and reducing the hospitality sector to a table service only, you are, in theory, reducing the number of people that will be out and about any given evening. But whether or not that's enough to actually contain and suppress this second wave is just very unclear.
Dr. Pankanya, this one from John, who says, where do the new restrictions stand regarding university students, especially given they're within the target age where we are seeing a rise? I've just dropped my son off at university. Should I be going to get him back?
No, don't bring your child back from university. It's very important that they take part in university. Now, most universities, I'm sure all, have made their own infection control plans. And nevertheless, it's important that the students also contribute, which is do all they can not to mingle excessively with large groups and to keep their circulation down. And also, at the first sign of any trouble, talk to the university authorities about getting tested. So, for example, my own university, University of Exeter, is paying for private testing for staff and students for exactly these sort of needs.
OK, Professor Vedhara, Sabine asks something on the same lines. Now that schools have reopened, how can we protect children and vulnerable adults, grandparents, from viral transmission?
I think this is a hugely important question, and I think fundamentally, and I think this is what's in the guidance at the moment, that children continue to, grandparents are excluded from these restrictions, certainly in the areas that are already locked down, then really, to my mind, the only way that you can protect vulnerable people, particularly in intergenerational households or where grandparents are doing the caregiving, is to have some sort of testing of children. And of course, that's hugely problematic at the moment because the testing system appears to have fallen over completely. So I think it's a cause of great concern for parents and all those people who are involved in caring for children at the moment.
Well, would you support what they're doing in Scotland, which is banning basically a visit from one household to the next?
My honest opinion is that I think it's only a matter of time before we're there. I can't see that the measures that have been outlined today are going to be hard enough or wide enough to achieve the suppression that we need.
OK, Dr. Pankanya, I saw you nodding away there, and Gemma has asked, is there any change to support bubbles? All the questions are along this similar theme, really.
No, there is no change to these support bubbles, if I've understood the question correctly. I mean, what is what is required, even at schools and the support bubbles, is you keep the numbers down. It is a human-to-human infection, and therefore you keep the size of your bubble down, you keep the number of people you're interacting with down. And to be honest, with respect to the schools question, my view is we need to accept that infection will be brought home by children to their parents or grandparents, and therefore, if they are vulnerable, they take precautions. Whatever precautions they can take, they ought to take.
Yeah, it's all about human behaviour. And Wendy asks a question, and I'm not suggesting she's trying to get round the rules, but she says, does the rule of six mean that it's always the same six people all the time, or does it mean you can have a group of people from you which you can choose another six people to have in the house later on in the same day? People are going to ask how you get round this.
And this is the problem with the rule of six. Also, there is a little bit of risk compensation. So when we hear from the government that a group of six is okay, people take that narrative to mean that, oh, I can mingle in groups of six, as many groups of six as I want. The clear message should be even your group of six is not safe. And if you have too many groups of six, you are unsafe, you will get infected, you will transmit it to others.
OK. Professor Vedhara, I'm being unfair. This is a question Sean has asked. Lots of people are going to want to know the answer to this one. Will we be able to spend Christmas with our family?
I think a lot of factors will determine that. Of course, it will depend very much between now and Christmas what we achieve in terms of suppressing the virus. It will also depend upon the size of our families. So if this very enigmatic rule of six still applies, then if your family constitutes six people, then possibly. I think it'll also depend on whether or not you've got any vulnerable people within your family who need to be shielding. So I think it's there's going to be a complex set of situations that people are going to confront over Christmas unless we can get a hold of this problem over the next few months, really.
I'm just reading a tweet from Emily Maitlis. It says, I've just asked a cab driver what he thought about the rule of six over Christmas, and he told me he thought it sounded blissful, which I shouldn't have read out. But anyway, Dr. Pankania, let's go to the next question, which is asking about a husband. This is from Trish. She says, my husband had a COVID test on Sunday. Over 48 hours later, he still has no result. When he phoned up, he was told that they don't chase up results, and if he didn't have a result within 72 hours, he should isolate for 14 days. What is the point, she says, of taking a test if they're not going to give you the results? Do I have to isolate for the 14 days as well?
This is so unfortunate because this person could have been infected and infectious, and he's waiting for a result. And in the meantime, he could have gone about infecting others and generating cases. What I would say is if they have what I would call signs and symptoms suggestive of a coronavirus SARS-CoV-2 infection, then the case must isolate for at least 10 days. And the contact of the case must isolate for at least 14 days.
Right. Professor, this one from James. What are the chances of the tests picking up on other particles from similar viruses in the same coronavirus family, such as the common cold, causing a positive test result? Also, I'll widen this out because people are going to be concerned about whether this picks up on flu positives as well.
I think that's a question for my learned colleague, but I think
I can answer.
All right, well, yes, I'll tell you what, Professor, you've built him up. Let's hear from him. Dr. Pankania.
The short answer is, please don't worry. These tests are very good, very specific, very sensitive, just for the SARS-CoV-2 virus. We are not going to pick up the influenza or the common cold virus. It's very sensitive, very specific.
Right, thank you for that, Doctor. Professor, I've got a holiday, says Ben. I've got a holiday planned in the UK with 4 of my friends. Is this still allowed to take place? Also, are we still allowed to meet inside, even though we're socially distanced?
So I think the answer to that will be, well, as long as your holiday party, which it sounds like it is 6 or less, then you're fine. As long as where you're going on holiday isn't one of those areas of the country that's already got more restricted measures in place, like the Northeast, where you can't mix households, then you should be fine. And what is key is that within the household, you do need to maintain those social distancing rules.
OK, now a final question, which I'll put to both of you. First of all, Doctor, this is from Lauren. What do you think that restrictions for maternity hospital appointments, when do you think they will be lifted? I'm 24 weeks pregnant and it's now beginning to worry about giving birth to our first child in January. My word, lots of people are facing this, aren't they?
Yeah, so I personally feel no one with any medical condition, especially a mother-to-be, should be denied their assessment, their review, their screening just because of coronavirus. If there are any issues, the mother will be seen, be it in the hospital or be it at home. I would like to reassure the mother that our National Health Service is going to see you through that pregnancy. It shouldn't be a case of you're pregnant, we've got coronavirus, you can't be seen.
Professor?
So if I've understood this question, I think this lady's actually asking about the restrictions in terms of who can attend appointments and possibly the birth with her. And I would say that she's highlighting a huge issue which exists not only for pregnant women, but for people contending with a range of different diseases for which they, use the NHS. And the honest answer is I would hope that we're in a position that things are better in January, but unless we get a grip of this virus, and we do so soon, not only are people at risk of COVID, but they're at risk of all of these other aspects of our health having to be managed in ways that are very uncomfortable for us.
I mean, this is very grim, isn't it? With childbirth, of course, it should be a happy moment, but for lots of people, it's a moment you're going to want a loved one with you.
Indeed, and we know how important support is in times of obviously the birth of a child is hopefully a very positive event, but as any woman who's had a baby knows, it has its stressful and traumatic periods, and you really do need someone with you. So again, my hope is if we can get a grip of the virus and suppress it, then things like this should not be a problem for people come the new year.
Quick final word from you, Dr. Pankania.
Yes, I think we should try and enable this. And I was very distressed when people were dying alone. So it is incumbent upon our healthcare services to enable these special moments, some of them very sad, some of them very happy, to happen, because otherwise we are building up a large head of steam of depression, anxiety, and anger. So whilst we're working on infection control, we should also work on enabling nice things and sad things to happen in a dignified way.
Yeah. Well, Dr. Bharat Pankania and Professor Kavita Vedhara, thank you both very much. Good to see you both again. Thank you.
Thank you.
Thank you.